Hello everyone. So today's topic is axilla. The specific learning objective of these sessions are, at the end of the session you should be able to describe the boundaries and content of axilla and the related applied anatomy. The content of the topics are boundaries, axillary sheath, axillary artery, axillary vein, axillary lymph nodes, scapular anastomosis and applied anatomy. So axilla is space between the medial part of the arm and the side of the chest. It forms an important passage for nerves and vessels from neck to the upper lip, and it has shape of a truncated three-sided pyramid. Boundaries: the apex of the axilla is directed towards the root of the neck. It is a narrow triangular gap which is bounded, you can see here, medially by the first rib, anteriorly by the clavicle and posteriorly by the scapula, and it is also known as inlet because it is allowing entrance of the nerves and vessel to the axilla. The base of the axilla faces inferiorly. It is formed by fascia and skin, you can see here, and the fascia is supported by suspensory ligament of axilla which makes the base hollow. The anterior wall is formed from above downwards by clavicle, then there is pectoralis major, deep to that pectoralis minor, then there is subclavius, and also there is clavipectoral fascia. Posteriorly, you can see here, there is the scapula and the muscles attached to a scapula on the dorsal aspect, that is subscapularis, then there is teres major and latissimus dorsi. The medial wall is formed by upper ribs and intercostal muscles covered by the serratus anterior muscle. So here is the medial wall, this is anterior wall, this is posterior wall, and the lateral wall, this one is lateral wall which is narrow. It is formed by the floor of the intertubercle groove of the humerus, to which tendon of latissimus dorsi is attached, in which tendon of long head of biceps is running. The axillary fold are anterior and posterior, which can be palpated by fingers, and among them the anterior axillary fold is formed by the lateral border of the pectoralis major, and posterior axillary fold is formed by the teres major and latissimus dorsi. Content of the axilla: there is axillary fat, there is axillary artery, there is axillary vein, there is branches and the cords and the branches of the brachial plexus, and axillary lymph nodes. First, axillary sheath. So in neck, the cervical vertebra and muscles attached to them are bound by a dense fascial layer called prevertebral fascia. The vessels and the brachial plexus enclosed in a fascial sleeve. So here you can see this structure. When they are entering the axilla, they are covered by a sleeve-like structure which is known as axillary sheath, and this axillary sheath is derived from the prevertebral fascia, which is nothing but from the deep cervical fascia of the neck. So here you can see the axillary sheath. This is the prevertebral fascia, and here is the axillary sheath which is covering the structure which are coming and entering into the axilla. So among the muscles of the neck, scalenus anterior and scalenus medius are attached to the anterior and posterior tubercle of transverse process of cervical vertebra, and the root of brachial plexus are lying between these two muscles, the scalenus anterior and scalenus posterior, and the subclavian artery is passing behind the scalenus anterior at the root of the neck. So axillary sheath here is a sleeve-like structure which is covering the brachial plexus and the axillary artery during their passage from the neck to the axilla. Okay, so that is axillary sheath. Now axillary artery. Axillary artery is beginning at the outer border of the first rib, and it is continuation of subclavian artery. It is continuing as brachial artery at the lower border of teres major. It is divided into three parts by pectoralis minor muscle, and the second part is located behind the pectoralis minor muscle. Then there is axillary vein, which is lying medial to the axillary artery, and then there are three cords of brachial plexus, which are named because of their relation to the second part of the axillary artery. So there is medial cord, there is lateral cord, and there is posterior cord of brachial plexus. Axillary artery branches. So axillary artery is divided into three parts: first part, second part, and third part. Second part is behind the pectoralis minor muscle. The first part gives superior thoracic artery, the second part gives thoracoacromial and lateral thoracic artery, third part gives three branches: anterior circumflex humeral, posterior circumflex humeral, and subscapular artery. The superior thoracic artery is branched from the first part of the axillary artery. It is a very small branch. It is passing between the pectoralis major and minor muscle. It supplies these two muscles and also the medial wall of the axilla. The second part of axillary artery gives two branches: thoracoacromial artery and lateral thoracic artery. Thoracoacromial is short and wide. It is piercing the clavipectoral fascia along with the lateral pectoral nerve and cephalic vein. And the thoracoacromial artery is dividing into four branches: acromial, deltoid, pectoral, and clavicular. Then second branch from second part of the axillary artery is lateral thoracic artery, which is following the lower border of pectoralis minor muscle, and it is important for the blood supply of female breast or mammary gland. Third part of the axillary artery gives two circumflex humeral artery. There is anterior and posterior circumflex humeral. Among them, the posterior circumflex humeral is important, and they are providing anastomosis around the surgical neck of humerus. And there is third branch from the third part of the axillary artery is subscapular artery. The subscapular artery is descending along the lateral border of scapula. It is ending as circumflex scapular and thoracodorsal artery. Circumflex scapular passes around the lateral border of scapula. You can see here circumflex scapular to supply the dorsal aspect of scapula, and this continuation of the subscapular artery is thoracodorsal artery, which is accompanied by the thoracodorsal nerve or nerve to latissimus dorsi, which is branched from the posterior cord of brachial plexus. Palpation of the axillary artery. Third part of the axillary artery can be palpated in the lateral wall of the inferior part of the axilla and can be compressed against humerus. Axillary vein. It is beginning at the lower border of teres major as a continuation of basilic vein, you can see here, and it receives tributaries. Among them, first one is vena comitatus of brachial artery, tributaries that correspond to the branches of axillary artery, and cephalic vein, the largest tributaries which is draining into the axillary vein. Axillary vein continue as subclavian vein at the outer border of first rib. So axillary vein is located medial to axillary artery, but when arm is abducted, it is lying anterior to the axillary artery, hiding it from vision, and because of its large size and its exposed position, it is liable to injured in the wounds of axilla. Axillary lymph node. So axillary lymph node are scattered in fibrofatty tissue of the axilla. Their number might vary between 20 to 30, and they are divided into apical or infraclavicular, pectoral or anterior, central, subscapular or posterior, and lateral group of axillary lymph node. So among them, the first here you can see the anterior or pectoral group of lymph node. They are lying along the lateral thoracic vein at the lower border of pectoralis minor. They are receiving the upper half of the trunk anteriorly and also major part of breast or mammary gland. Axillary tail of Spence is in actual contact with these lymph node, that is anterior or pectoral group of axillary lymph node. Cancer involving the axillary tail of breast may be misdiagnosed as enlarged lymph node. Then there is posterior or subscapular group of axillary lymph node. They lie on the posterior axillary fold along the subscapular vein. They receive lymphatics from upper half of the trunk posteriorly and also from axillary tail of breast. Then there are lateral group of lymph node. They lie along the upper part of humerus in relation to axillary vein, and they drain lymph from the upper limb. And here are the central group of the lymph node. They situated in upper part of axilla. They receive lymph from all other axillary group of lymph node except the apical group, and they drain into apical group. The intercostobrachial nerve passes through these nodes, that is the central group of axillary lymph node. Enlargement of these nodes, such as in cancer, may compress this nerve, causing pain in area of distribution of this nerve, that is along the inner border of arm or medial border of the arm. And the last one is apical or infraclavicular group. They are situated deep to clavipectoral fascia at apex of axilla along the axillary vein. These group of lymph node have great clinical importance because they receive lymph directly from upper part of the mammary gland here or breast, and they are also receiving the lymphatics from the all other lymph node which are draining into central group, and from central group to the apical group. And from apical group of axillary lymph node, the lymph is drained into the subclavian lymph trunk on right side and thoracic duct on the left side. Few efferent from the apical group of axillary lymph node may drain into supraclavicular lymph nodes also. The last part is subscapular anastomosis before we go to the applied anatomy. So scapular anastomosis, here several vessels are forming an network that provide collateral circulation of upper limb during ligation of injured axillary or subclavian artery. So as we know that subclavian artery is divided into three parts by scalenus anterior muscle, and first part is lying here medial to the scalenus anterior muscle, and the first part has the branch which is known as thyrocervical trunk. Apart from vertebral artery and internal thoracic artery, so this thyrocervical trunk gives three branches. One is inferior thyroid artery, and remaining two are, one is transverse cervical and another one is suprascapular arteries. Now this transverse cervical has one ascending branch and one descending branch. This descending branch go along the vertebral border or medial border of the scapula, and there is suprascapular artery which is crossing the transverse ligament of the scapular notch. It passes through the supraspinous fossa, then around the lateral border of the scapula it reaches to the supply the infraspinous fossa. So this scapular anastomosis is formed between the branches from the first part of the subclavian artery, that is two branches, one is transverse cervical and one is suprascapular artery coming from the thyrocervical trunk, and there is subscapular artery which is giving circumflex scapular artery. So the scapular anastomosis consists of subscapular, suprascapular and the descending branch of transverse scapular arteries, and that is a communication or anastomosis between first part of subclavian artery and third part of axillary artery to bypass the ligation or any pathology involving the here involving the axillary artery first part and second part, and subclavian artery second part and third. So this scapular anastomosis is here providing this anastomosis around the scapula between the first part of the subclavian artery and third part of axillary artery. Now the applied anatomy is there is axillary arch which overlies the axillary vein. Sometimes this axillary arch may compress the subaxillary vein in case of excessive or unaccustomed activity of the shoulder joint, which might cause formation of spontaneous thrombus in the axillary vein. Axillary lymph node can be palpated as a part of clinical examination of breast due to their involvement of cancer breast. Then there is axillary breast. You can see here an axillary abscess in axilla arise from infection of axillary lymph node. The pus of axillary abscess may track into neck or into arm if it enters axillary sheath or between pectoral muscle, if it breaks through the clavipectoral fascia, and you can see here how it is drained. Axillary abscess is drained by giving an incision in floor of axilla midway between anterior and posterior axillary fold nearer to the medial wall to avoid injury to main vessels running along the anterior, posterior and lateral wall of axilla. So axillary vein is here might be a site of severe hemorrhage in case of if there is any injury to the axillary vein, and there can be chance of air embolism because air might enter the axillary vein because this wall is held apart by fibrous expansion over the vessel from the clavipectoral fascia. So that is about the axilla, and these are my references. Thank you.